Well, this is a new virus, and I understand that people are worried, they are concerned. There's uncertainty about how it spreads and the disease it causes and the impact it will have. So let's look at the facts. 99% of all reported cases are globally or in China.
Yep.
And out of those, 97% are in Hubei province.
Right.
So the risk for transmission is very, very high in China and is high in other parts of the world. So based on the information we have today, like other respiratory infections, the novel coronavirus, or the 2019 novel coronavirus, how we call it, causes a range of symptoms from very mild disease to severe disease, including with a lung infection, pneumonia. And it can progress in the majority of cases. It's a mild infection.
Yes.
And in about 13% of cases it can progress to severe disease, and only a very small proportion of confirmed cases have been fatal, very small. So what we have learned so far from the cases reported globally, and mostly actually from China, is that those who are affected predominantly are above 60 years of age and or have underlying diseases, comorbidities we call it, like diabetes or something, some more comorbidities like that.
Right.
We need to learn more about the spread of the disease. The data we have currently is that the majority of cases are in populations above 60 years of age.
Right.
We have good advice how the public can protect themselves and their families. And I would like to start off with this. Number one is hand hygiene.
Yes.
Washing your hands with soap and water or alcohol-based hand rubs. Avoid touching your face. Keeping a distance. This is an infection which is transmitted through droplets. So a meter will do.
Right.
Stay at home if you have mild respiratory symptoms, or seek medical care if you have fever, cough, and difficulty breathing. In particular, when you have a history of travel history to China and Hubei province in particular. All these myths and fake news which are going around, and they contribute to anxiety, to the concern about this outbreak. So it can be really very harmful. So it's we need to really focus on what we know. There are many unknowns, but we should focus on what we know, and we should also be very cognizant of what we don't know.
Right.
So coronavirus infection causes a respiratory disease. The major driver of transmission is through droplets of symptomatic patients who cough and sneeze, and we know how to protect ourselves. I think Malaysia is doing very, very well. They're very open, very transparent. All the information about the case investigation, the results of the case investigation is available immediately on the Ministry of Health website.
Yes.
They also post new information, very accurate information which is validated on their social media.
Right.
They're also in close contact with authorities in Singapore and the neighboring countries.
Right.
So we are impressed about the quality of the work. It's a difficult situation. So our WHO representative to China, Gauden Galea, he has been visiting Wuhan with the team, and he has visited the facilities. So I think the main aim, the main objective is to curb the outbreak. And the Chinese authorities have taken extensive measures which they think protect their population.